Let's talk about like the semen analysis, like some terms that people might hear. Like I remember motility and I think mobility was another one. Like what are those specific terms that somebody might see in their semen analysis? What are good numbers for these things?
Yeah, sure. So again, I like to say these in phrases that patients, average person who doesn't know medicine understands. It's like me and being a car mechanic. I know very little about my car, really, and so they could completely hoodwink me, right? So I like to at least know what they're saying in normal ways of talking. And the way I best describe a semen analysis, and again, this is telling people who might know sporting analogy, is a semen analysis is like a baseball stats, is a baseball batting average or baseball stats, batting statistics. Okay. Every single digit in that is at bat once, which is like a semen analysis the first time, but it's the average that matters more, right? When you have an accumulation of 2 or 3 sometimes semen analyses. There's the volume of semen. There's the pH, also how acid or alkaline the pH of the semen is, and it should be alkaline. Above 7.2, 7.4, something like that. Then there are reference values, which I'll talk about in a second. There's sperm concentration, which is how many million or not million there are per milliliter, or cc is the other word, centimeters cubed, or milliliters is milliliters exactly. And then there's the motility, which is really just a swimming ability. Okay. And you imagine someone looking down a microscope or boats on a lake and trying to catch zipping sperm. I mean, how accurate can you catch it in a grid? Well, computers can do that a little bit better now. They can track sperm moving across a field. But within that motility, there's how rapidly moving they are, to slowly moving, to twitching, to, not moving at all. So we can subdivide it. Then there is the morphology, which is by far the weakest, and I hate that test because it's literally doing that caveman thing. You look at the length, the width, the bits and bobs made, split tails, double tails, kinked neck, and the significance when you look at the 4% normal, which is the reference value, by the way, it goes to show, my goodness, only 4% of my sperm have to be normal shapes to be normal. The answer is yes. But the problem is the validity and the value of the test is becoming questionable because people still get A, pregnant, and B, can do artificial insemination. And we don't often look at the morphology if there's all bad sperm when we do in vitro. We take the best bad-looking sperm. So morphology is starting to become a little bit annoying in terms of value. All right. Now, that's all individual stats. Now you want to know how good a swing was in baseball, right? And you get a sense of how much connectivity of that bat to ball was. So you have to stand back from a minute and look at the whole picture. And that involves what we call the total modal count, the volume multiplied by the concentration, that gives you the total number of sperm in the specimen, multiplied by the motility, that gives you what they call a total modal count. That's more useful. How many moving sperm are in that whole specimen that are either going in the vagina, to the cervix, up the uterus, or that they can process for potentially artificial insemination or IUI, intrauterine insemination? Because those numbers matter. But again, those numbers don't tell you functionality. And that's the biggest problem with semen analysis, okay? Now, the dreaded word normal, right? Normal. Or reference value. I hate the word normal, all right? I absolutely hate it. But I find myself still saying it, reference value. So you'd think in the 21st century, again, we'd have a very robust knowledge of what the reference value of achieving a pregnancy is. Well, they did do it in 2010. Eventually, it took a while. I mean, goodness knows we've had semen analyses for at least 30, 40 years, of course. And actually more than that, 40, 50 years in terms of really measuring it. But the thing is, when they then look at it as a reference value of all blood tests, okay, how do you know what that value is in men who achieved a pregnancy under 1 year, which is a definition of infertility if you achieve if you don't get pregnant within a year, right? So they took about 800 men. We think 800 men, not just in one country, around the world. I'm like, that's pathetic, right? But needless to say, They did take a large number of men, at least around, who have different lifestyles, different genetics, different diets, and try to define what that reference value should be globally. One should really do that within a region. Maybe southern states different than northern states, maybe this diet, that diet, who the heck knows. But within your region, you should probably work out that reference value. But they have done it for an international level. And that's when the 15 million per cc or milliliter, the 1.5 cc's, the 40% swimming ability, and the 4% morphology are kind of defined as the cutoff. Now, the problem with that cutoff is this. Everybody in that study achieved a pregnancy under 1 year, okay? But statistically, they had to create a cutoff, which is statistically done at the 5%, and then the other side is 95%, just because of statistics to create it. Because technically everybody from very low numbers to 15 million per milliliter also achieved a pregnancy under 1 year. But how many people was that? 5%. 95% of people achieved a pregnancy under 1 year above that. Okay? So what's the mean or average, or what's an average guy who actually achieves a pregnancy under 1 year? It's not 15 million per milliliter. Where you want the 50th percent, where you want the 50th percentile in the middle, 50 who got pregnant above this, 50% got pregnant below this. But what's the average, okay, that a man has? That's really about like 40 to 50 million, etc. Right? And there's the numbers higher. But so again, when we play to the test, it's saying, well, you're above 15 million, but you're not 40 per milliliter or 50 million per milliliter. You know what I mean?